Wonderful. Welcome everyone, and thank you very much for joining us for this very special presentation today. This is part of our week-long series of wellness presentations, and we are featuring some of Calgary's leading providers of information, products, and services for 55 plus lifestyle. We hope that through these presentations to provide you with ways to enhance your health, stay active, and live your best life. As we gather here today, it's vital we also remember the peoples who've gathered here for millennia. This is the Treaty 7 land of the Indigenous peoples of southern Alberta, the Blackfoot Nations of Siksika, Piikani, Kainai, the Tsuut'ina First Nation, the Stoney Nakoda Nations of Chiniki, Bearspaw, and Wesley, and the historic home of the Northwest Métis and Métis Nations of Alberta Region 3. It is with the goal of reconciliation that we acknowledge the land on which we gather, and we thank the elders of these nations for their timeless contributions to this land. And today we feature Pharmacy at Your Door by CareRx and are pleased to welcome Jerry Zhang. Jerry is a recent graduate from the University of Alberta, where he obtained his Doctor of Pharmacy and Masters of Business Administration degree. Prior to joining CareRx, pronounced CareRx, he had worked. Thank you, Jerry.
He had different interpretations. That's why I had to put that in. Yeah.
Jerry had worked in various community pharmacies, including Safeway Pharmacy and London Drugs. He is passionate about chronic disease management and also has strong aspirations in the business world. Currently, he's a project lead for the leading virtual pharmacy in Alberta, Pharmacy at Your Door by CareRx. Jerry, tell us a little about Pharmacy at Your Door and what is osteoarthritis?
Perfect. Let me just share my screen here first. Okay, you see my screen here, okay?
Absolutely, it looks great.
Well, good afternoon, everyone. Thank you so much for the introduction, Colleen, and it's really a pleasure to be here today. I hope today's conversation will provide everyone with more information regarding one of the most common medical conditions in the community. Before kicking things off, I just want to thank Colleen for arranging this virtual health week and the opportunity for Pharmacy at Your Door to be part of this special event. As Colleen had introduced, I am a pharmacist by training, so I'll be speaking on the topic of arthritis through the lens of a pharmacist. So in today's presentation, I'll first talk about what is osteoarthritis, including its typical presentations, the prevalence in the community. I'll also address, the potential risk factors of osteoarthritis, and then I will address the different treatment options available to us, whether that is over-the-counter medications, prescription medications, or surgery options as the disease progresses as well. And lastly, I want to take a few minutes to speak about our services at Pharmacy at Your Door, the leading pharmacy that brings all pharmacy service to you without leaving the comfort of your home and offices. So let's dive into the presentation here. So what is osteoarthritis? So osteoarthritis itself essentially is the loss of articular cartilage. It is a progressive disease of the entire joint that leads to the breakdown of joint cartilage and the underlying bone. There might be a few different contributing factors to this, including trauma, injuries, or secondary infections as well, which I'll touch upon a little bit later. So there are typically two types of osteoarthritis. The primary arthritis is essentially idiopathic and is often seen as we age. The secondary osteoarthritis is generally the result of an insult to the joint, for example, trauma, post-trauma joint malalignment, or joint infections. Another possible reason for osteoarthritis is rheumatoid arthritis as well. The most commonly affected joints are the knees, the hip, big toe, hands, and the spine. Out of these five anatomic structures, the most common ones, or common three, are actually your knees, hips, and hands. This is a wear and tear medical condition, which means the more we use a specific joint, the more likely that it will suffer from osteoarthritis. So out of these five joints I mentioned earlier, so your knee, hip, and hand is actually the most common joint affected with osteoarthritis. And moving on to the common presentations of osteoarthritis at the community level, the key symptoms and presentation of osteoarthritis is actually pain, stiffness to the affected joints. The pain itself typically worsens after exercise and improves with rest. The stiffness is actually a hallmark sign of osteoarthritis, but it usually only lasts less than 30 minutes. However, it's more common when you wake up in the morning or before going to bed, also at times of inactivity. And as your physician completes further investigations, examinations, diagnostic imaging will likely demonstrate established structure damage to your joint if you do have osteoarthritis. So if you do experience some of these symptoms I've described earlier, I do recommend you to speak to your physician in regards to your concerns and request further examination. I also wanted to mention that it is important to not confuse osteoarthritis with rheumatoid arthritis. So rheumatoid arthritis is actually quite different from osteoarthritis, although both of them focus on the joints um, of the body. Rheumatoid arthritis is an autoimmune disease, and there are more structural deformities and damages related to it. For illustration, the bottom right corner is a presentation of rheumatoid arthritis, where the top image is more related to osteoarthritis. Moving on to the prevalence of osteoarthritis in the community. Osteoarthritis is actually one of the most common chronic joint diseases in the community. In the Around the world, there's about 242 million people living with activity limiting arthritis. So it's definitely something that is very prevalent in the community. Hence why my presentation today to raise awareness and to talk about this disease as well. And as I've mentioned in the previous slide, osteoarthritis is a wear and tear medical condition. So as as we age, as we use more uh, of our joints, whether that is our hand, hip, or knee, um, it's very likely that most of us will have this disease. So around the world, about 80% of the population do have some sort of osteoarthritis as well. Moving on to the different risk factors of osteoarthritis. Um, Osteoarthritis, the risk factors can really be divided into preventable risk factors and non-preventable risk factors. Occupation, sports, and trauma are very common preventable risk factors for this disease. As I mentioned before many times now, this is a wear and tear disease. So repetitive and excessive mechanical stress and motion will increase the risk of getting this disease. So some common occupations that we see at community level that have this disease, including pipe fitters, plumbers, and also different occupations like if they occupation like sports, athletes as well, just because of that repetitive and excessive mechanical stress to the knees and the hip, very likely to see these type of disease in these type of population. Muscle weakness is also a potential risk for uh, risk for osteoarthritis. As you can imagine, with lower muscle strength, this will translate to more stress to your physical joints, which leads to further mechanical stress. Obesity is also one of the most important risk factors as well. It is highly predictive of knee osteoarthritis. More weight to our body translates to more stress to our knees, which again increases the risk of osteoarthritis. This obesity is listed as one of the most important preventable risk factors, as obesity is often related to other important medical conditions such as diseases of your heart, your kidneys, also medical conditions such as hypertension as well. The two non-preventable risk factors are your genetic makeup, age, and sex. Of note, females actually have higher risk of getting osteoarthritis, and this is something um, that's something we cannot change, and largely due to our genetic makeup of our muscle mass and bone structure as well. Now moving on to some different treatment options of osteoarthritis from a pharmacist perspective as well. I wanted to start off with a potential non-drug measures. So on the right-hand side here, you can see is a pyramid that clinicians refer to when we're looking at the management of osteoarthritis. So as the disease progresses, we have to take more severe measures to combat the disease, whether that is the pain or the stiffness that you're suffering. Um, However, there are many techniques and measures we can take to prevent the disease progression. For example, weight loss and maintenance is definitely something that I would recommend to all patients if they are overweight. So by overweight, I mean you do have a BMI of over 25, and that can be calculated by using your weight and also your height. And as I mentioned before, obesity is one of the most important risk factors for many other medical conditions as well. So weight loss is generally a good health advice for all patients. And likely with weight loss, exercise and physiotherapy is a great non-pharmacological alternative as well. Um, Something we always recommend is aerobic training on an average of 150 minutes per week, which can translate to about 20 to 60 minutes per day, 5 days per week. Some of that aerobic training includes jogging, swimming, hiking. Depending on your own interest, you can pick your own aerobic training as well. Also, strength resistant training is definitely recommended to as well for all major muscle groups. I definitely recommend you to consult with whether that is your physiotherapist or exercise experts to recommend an exercise that helps you 2 to 3 times per week, just to increase that uh, muscle strength for specific groups 2 to 3 times per week. And also stretching is something that we recommend on daily basis as well, just to prep you for those aerobic training and also different strength exercises. Orthotics and aids to daily living is also something we recommend if it's required by specific patients. For example, different type of shoes that fits different type of arches will also help you to navigate whether that is during exercise or physiotherapy training sessions. And unfortunately, as disease progresses to a point where um, the pain is no longer tolerable or your activity is severely limited by this disease, surgery is an option at end of the line. Different types of surgeries available include total joint replacement or hip replacement or arthroscopy. I actually had an opportunity to uh, complete my internship at the Orthopedic Surgery Center in Edmonton here. So I do see a lot of patients come in for these surgeries, and is actually very effective. Is it really decrease their pain level from maybe a 7 to a 2 or a 3, and it's essentially a new joint for you, and the pain level is a lot more tolerable, and a great success for the surgeries as well. Now moving on to some of the drug measures that could be used for controlling the pain, and also also some natural health products that are available as well. I want to focus on the over-the-counter medications because these are the ones that you could take for self-help. And for other medications that require prescription, you need to see a physician as well. So for oral medications, in regards to the over-the-counters, I do recommend Tylenol as first line because it's considered one of the safest medications available, and that is a key reason why we offer it as a first line treatment. Advil and Aleve is also something that is available over the counter. Um, is actually quite effective in regards to pain control. It's more effective than Tylenol. However, there are some complications and side effects that doesn't fit with everyone, especially if you had gastric ulcers in the past, or if you have severe hypertension as well. You definitely want to speak to your pharmacist and your physician before taking some of this medication, just to make sure that your individual medical conditions and medical profile um, does not interact with these medications. Interestingly, there is actually a natural health product called glucosamine and chondroitin that have some evidence in treating or decreasing the pain of osteoarthritis. In the research world, the evidence is a little bit controversial. However, some studies have shown evidence in using this medication. So it's important for you to consider the risks and benefits of this medication, and to talk to your pharmacist about that as well. As a disease progresses, and when the over-the-counter medication no longer effective for you, or you need a little bit more severe painkillers, there are other options that requires a prescription, such as opiate medications and other medications that may help with your neurological pain as well. There are also a few topical choices available, and I will actually suggest using topical creams before using oral medications, just because of its safety profile as well. As you can imagine, these creams and gels are not readily absorbed into our body as much, but it works very well locally. So the first line I would recommend is Voltaren. Also, this is an anti-inflammatory medication that is in the same class of Advil and Aleve, and it's quite safe to use as well. Some of the other options available includes capsaicin creams and A535. Those are also very effective in regards to the pain reliever for the topical class. Um, Another option in regards to drug measures that are available for us is the joint injections. So this definitely requires the maneuver of the physician. So the key medicinal ingredient involved here are corticosteroid and hydrochloric acid. So these two typically increase the lubrication of the joint, also decrease the inflammation in the joint, and they are very joint specific, and they're mostly used for your knees and this specific joint that you're suffering just intolerable pain. There are some limiting factors with these injections, and they're only used just about 3 to 4 times per year. So you have to put those considerations in mind as well. So this concludes my first portion of the presentation in regards to osteoarthritis. Now I wanted to quickly talk about some of the service offerings we have at Pharmacy at Your Door as well. So Pharmacy at Your Door as a company, we launched in just in Calgary here back in July. And our goals are to bring the safest and most convenient digital pharmacy service to patients' homes and offices. It really comes down to three key pillars of our service offerings. First of all, our packaging is actually quite different than the community pharmacies. Since this is our package called Easy Pack, so all of your medications is actually pre-sorted by our pharmacists and checked by our pharmacists, and they're arranged in this pack here. So as you can see on the right hand side, our patient Susan Johnson here is taking this medication on Sunday at 8 in the morning, and all of their medications pre-packed into the pouch, so there is no confusion, so that we know that you're always taking the right medication at the right time. Um, every month you will receive Easy Pack dispenser from us that includes these type of Easy Pack dispensers and strips, and it will last you for a month. And we do have automatic refills, so you will never have to run out of refills as well. Um, the second pillar to our service is our on-demand delivery. So as you can imagine, amid COVID and during the winter times, it's definitely not recommended um, to go to local pharmacies as people do gather at those places. So we do provide on-demand deliveries. For example, if you're just at a doctor office, you can directly fax your prescription to our pharmacy, and we deliver it to your house within 4 hours. And so you don't have to arrange for any transportation. You don't have to wait around for that prescription at all to pick up your medication. We are also a full service pharmacy. So that anything you find at a community pharmacy, we do have that available as well, and is available for you for delivery as well. We also have a platform that connects you with the pharmacist virtually. So again, you do not have to visit our pharmacy to speak to our pharmacist. You do have the choice of speaking to our pharmacist through the phone, or also about or virtual platform. And as members of Pharmacy at Your Door, we do have a free annual medication reviews for you, just to make sure that your medication is still the right medication for you. And since people do change and circumstances change, and the medications should change for them as well. So we do have a pharmacist that checks your medication on a monthly basis as well. And lastly, I'm sure you have wondered about the cost of our service. So our cost is free for all patients. Patients only pay for the medications they take. With delivery, all of our prescription deliveries are free within 4 hours. All of our deliveries on a monthly basis is free as well. Packaging is free, and our pharmacist consultations through our virtual platform is also free as well. So it really is a great choice in the winter times, and also during the pandemic as well. So this concludes my presentation. I hope everyone had learned something throughout my presentation, and I welcome any questions at this point in regards to osteoarthritis, and also maybe our services at Pharmacy at Your Door as well. Thank you.
Great information, and it looks like you've got lots of convenient locations throughout the city by looking at your map there. One quick thing that might be of interest is, do you have the capacity to provide vaccination in home for people that can't maybe get out, their flu, pneumococcal, that kind of thing? Is there any capacity for that?
Unfortunately, at this point, just because of COVID restrictions, we're not allowed to go into the homes at this point. We are referring to patients in the community just to their physicians, as they do have more of that facility, and they do have that safety measures in place. Also, the different community pharmacies do have that available in their stores as well. So I do recommend everyone to get their vaccines in place at those destinations.
Good news. And I was also interested in, it's great that there's no fee for the Medipacks, just the medications itself. It looks to me as if that would be a very convenient way of being able to manage your medication. I know that, how many times do you say, oh my, did I take it? Did I not take it? Even if you put it in the little boxes, sometimes you forget. So I think that would be a great, I think that would be a great service for
Eh,
people.
Yeah, exactly. Actually, this is what they use in the hospital, actually, for the nurses to administer this. So there's no room for error. So exactly know what time the client is taking this, and it's all pre-packaged. So we have taken this and we have learned this from the hospitals, and just want to make this available to seniors and individuals in the community who take multiple medications. And as a company, actually, we actually are a subsidiary of a company that runs multiple pharmacies for long-term care facilities. So we do have the expertise for the geriatric and senior population.
Great service. And we have quite a few questions and some chats coming in. If you like, I can read those off for you.
Sure.
Uh, I basically smashed, from Maureen, I basically smashed the shoulder ball part of my humerus in a fall almost 22 years ago. It was surgically repaired, but I permanently lost some mobility and often feel some very minor pain, especially when the weather changes. Is this a joint which could be subject to eventual development of osteoarthritis due to trauma?
Yeah, I would believe so. Osteoarthritis, as I mentioned, one of the key risk factors is trauma, and because of the trauma, there just within that joint itself, there's very disruptive forces to your cartilage. So I would just definitely it is something that could contribute to osteoarthritis down the line. However, I do recommend you to speak to your physiotherapist in regards to they are really the experts in increasing that mobility and giving you exercises to train on daily basis for that recovery. Um, so I hope this answers your question.
Excuse me. Anonymous, it sounded like you were having some sound issues there earlier. Hopefully you got
Mhm.
that resolved and you have been able to hear Jerry. And again, the sound's coming across fine, and we will share the video. So if you had any problems there, you'd be able to review that again later. Sharon has mentioned that the presentation is mainly about medications. She just wonders what your opinion is about things like acupuncture,
Mhm.
laser, heat or ice, maybe
Mhm.
marijuana even.
Yeah.
Do you have an impression on those?
Yeah. I had a conversation with actually one of my close friends who is a physiotherapist in training. And she actually did recommend acupuncture and heat or ice for that, especially when in the morning for the heat or ice and also before bedtime, especially with heat actually it is definitely something that can be used to just to increase the activity in that specific region. And in terms of marijuana, there haven't been any studies regarding marijuana in terms of osteoarthritis pain. But I also have a hopeful um, outlook for marijuana as there are so many other researches going on in regards to marijuana, whether that is seizures, pain, PTSD. So I maintain that hopeful outlook for marijuana in regards to pain.
Still some work to do there.
Mhm.
And what happens, Elizabeth would like to know, what happens if the doctor changes medication in the middle of a package that you may have received?
Yeah, great question. So if there is any changes to the medication in the middle of the package, we will send you a replacement, whether that is, for example, if we're very early on in the month, we'll likely give you a replacement or we'll just give you a single vial that is the new medication, or if that is something you're not comfortable, we may look into changing the blister pack for you, just to make sure you have the most up-to-date medication. However, for the next months, as we have incorporate this change into your next blister pack, is not something you need to be worried about at this point.
Good to know. And Barb would like to know if you have actual retail locations where people can shop, or is it strictly delivery service?
So at this point, um, we're only having delivery services and strictly delivery service. It is just our business model, and this is how we see we can really help people in the community by keeping their costs down as well. So essentially, we want to provide these services for people who are at home and they do not have to visit stores at this moment with our delivery service, with our virtual services as well.
So the locations that were shown on the map, then those are the locations of where you're delivered.
Delivery, yes, those are examples of where they were delivered on a specific day. However, our physical location is in the southeast, closer to Glenmore and Stony. I think Stony. I'm from Edmonton. Actually, I'm not too familiar with Calgary area, but we're only using our delivery service at this point.
Okay. And there are several coming in through chat as well. We'll get back to questions here in a minute, but we'll get to some of these chat questions. PL Romay, do you need a prescription sent to you from your doctor? Up to how many pills can you send per prescription?
Yes, I can. I can talk a little bit more about that. You can directly fax your prescription from your doctor office. For example, after you have your doctor visit, you can ask the front desk or the medical office directly fax it to us. Uh, we take as many prescriptions as you need. There is no maximum number of prescriptions to that. And you can also visit our website, pharmaceutor.ca, where it has our contact information in regards to the fax number, also our phone number as well.
Great. And Jill has provided an answer to a question I answered earlier, kind of off topic here, but has suggested that Direct Health Solutions might be able to provide a nurse practitioner to go in home to do immunizations. And PL Romay has said thank you for that information. Also, Sandra, what are the dispensing fees for medications?
Yeah, so our dispensing fee is competitive with Shoppers, Rexall, and all of the big chains as well. It's heavily regulated in Alberta College of Pharmacy and also Alberta Health Services. The dispensing fee in Alberta here is $12.15.
Okay. Uh, do you need to register on your website or anything to have prescriptions delivered?
No, you actually can just give us a call at the customer service line. Um, we have a wonderful customer service representative, Megan. She is there 9 to 5 to help you and guide you through the registration process. It will likely take less than 5 minutes just to gather some of your background information and the delivery address and how to transfer your prescription as well.
I think you have your last slide. I think you have your numbers showing there, do you? If you want to show that again.
I don't have the number here, but let me just.
People can go to your website and get that customer service number.
Yeah. Let me just share a different screen here.
Other good information for people to have so that they can contact you following the presentation.
Yeah, I have our website up here is pharmaceutor.ca, and our phone number is here, or you can leave your name. Our customer care team member will get back to you as soon as possible.
There you go. And I encourage anybody that is interested in more information to go directly to a pharmacy at your door. And great to have that information at hand. Thank you. And again, that'll be shared again through the video. Or if you need to reach out to Jerry, just let me know. And so also following up, I think on a previous thought here, Wendy would like to know, what are your thoughts on CBD oil?
Very similar to my initial answer to the other cannabis question. The CBD oil is the release is a little bit different than how whether that is smoked, whether that is in edible form, but essentially the medicinal ingredient is very similar. Like I said, there isn't much evidence in the science world regarding how it treats pain and also other medical conditions. So I do stay hopeful in that more research to come. So there is more work to do in that area.
Mm. And it was interesting to know the various types of arthritis as well, that, you know, when people say I have arthritis, you know, I guess that seems to be all encompassing. So it's interesting to know that there are various types and treatments for each one. Another question here. Anonymous, thank you for the presentation, especially the self-help ways of treatment. I try to exercise and stretch, but I see that I need to do it more regularly and for longer periods of time. Well, we hear you, Anonymous. And I was this whole week, you know, with having several different presentations on various illnesses over and over again. You know, looking after yourself, eating well, exercising, reducing your weight, obesity being a major factor there. So I hear you that it's something that we all need to look at, and getting more exercise.
Yeah, especially with more restriction in regards to going outside. It's definitely a good idea to have these type of regimens in place, to have these exercise maybe in between, whether that is work or whether that is meetings, whether that is after dinner or after lunch, to have those exercise regimen in place, so that is something regular that we can back to. Yeah.
Particularly during these times when we're all
Yeah.
kind of isolated or working from home, sitting
Mhm.
at a desk for hours and
Yeah.
thing,
Yeah.
that we remember to get that little bit of exercise and stretching in. Fran Lou would like to know what the difference between osteoarthritis and arthritis might be.
I think arthritis itself is more of a encompassing term that talks about all of the arthritis in the world, but osteoarthritis more for your joints, and that is I think the key difference there. But I think osteoarthritis is under the bigger umbrella of arthritis itself.
Maybe at this time I can let you know, Fran, that we will have a presentation tomorrow directly from the Arthritis Society, so that might answer your question as to the various types of arthritis and the differences and that kind of thing, if you're to join us tomorrow. And so Maureen has noticed that there's vitamins included in the Easy Packs.
Yeah, that's right. So essentially anything um, you take orally, we can have them incorporate into the Easy Pack. You can have, your baby aspirin. You can have your medications such as for diabetes, hypertension. You can have multivitamins. You can have vitamin D tablets, calcium. So anything that you take on a regular basis, and we can order them from or drug manufacturer and have them inserted into your Easy Pack here at no additional cost.
It's a very convenient way of, as I said, so easy to forget, at the end of the day, oh, I forgot to take my vitamins today. And even if
Yep.
taking your prescriptions. So it's an easy way to resolve that. Is it more economical to have them in your blister packs as opposed to, or in your packs, as opposed to buying bottles of vitamins?
I think we how we do the pricing here is actually by pill. So I think it's going to be very comparable. If you take 28 tablets of multivitamins per month, that is the price we will have. I think it's going to be very comparable to what you have available in a normal bottle setting as well.
So comparable to buying them, but far more convenient.
Yeah.
And then not having to run out to the store to get some, and that kind of thing. And then having the pharmacy consult, what vitamins should you be taking, probably would be an asset there. Fran has said thank you. There's a couple of other Q&As, questions coming in. No, that was from that. Oh, chat. We have a chat here. Wendy, very good information. Definitely need to exercise more. And thank you for all of the information. So I don't know, does anyone have any further questions here of Jerry? That another thank you very much, and thank you all for joining us and for some great questions here. If no one has any further questions here, we have I would like to know, do you regulate what vitamins, etc., if it affects the meds? That's a good question.
Yeah, as pharmacists, we're really trained on to spot these interactions between vitamins and medications. So as you can see here, you can take this medication different times. So we have 4 different time slots: morning, noon, um, dinner, and bedtime. So if there is any interaction between your medication, we will space them out and we will spot them before handing this out to you. So you can rest assured that we do take a very close look at these medical interactions. So for example, if you're taking a medication called alendronate, which is for osteoporosis, and you're also taking a multivitamin, will definitely space this out by a minimum 4 hours, so there is no interaction whatsoever for that medication.
And Terry would like to know if you direct bill to Blue Cross or other.
Yes, definitely. We take all insurance plans: Blue Cross, Sun Life, Manulife, essentially anything you need at a community pharmacy level. We can provide that at our pharmacy with our delivery service and our virtual care service.
Excellent. Well, it sounds like a very valuable service for us. And as you said, particularly during this time when, now is even more so as we're tightening up and encouraging people not to go out, regardless of whether COVID or people are just, kind of isolating because of the winter getting a little treacherous maneuvering outside, that this would be a great service for people just to be able to have their medications delivered to their home and not have to worry about going to the pharmacy. What about non-prescription items? Are there, like, if you were go to the grocery or the drugstore, for example, and for items, say, for example, distilled water people might need for their CPAPs and things like that. Do you include that kind of thing as well?
Unfortunately, our main focus is on pharmacy with medication specifically. So I wouldn't say all items from a typical community pharmacy, such as chips, such as waters, but we do provide most over-the-counter medications, anything medication related, and some toiletry items, as well as we are a service provider for the long-term care facilities in Calgary as well. So we do have some of that. You can definitely give us a call at the number on the screen here, and our customer service representative Megan will address your question in regards to some of that availability as well.
Yeah, and like distilled water, I know it's something that
Yeah.
people use quite regularly. A little hard to carry around those jugs when you're maneuvering in the snow. And how about, Maureen would like to know, how about any special instructions, such as with food? Then presumably that information is provided along with the prescription.
Yeah, before we send this out to you, especially at the first consultation between yourself and the pharmacist to arrange, what time to take the medication and your preference, our pharmacist will provide that specific instruction for you. And if there is a special instruction with the food, we can put it in a different time slot, maybe at 4 p.m. or 3 p.m., depending on the medication and your own preferences as well.
Wonderful. Well, great information. It looks like we're just about out of time here. If anyone has any further questions. Otherwise, Jerry, if you don't mind stopping your screen share, I'm just
Yeah.
going to put a little something up here as well. And again, I would encourage everyone to follow up with Jerry or your pharmacy at your door, customer service for any further information. And we, again, will certainly provide you with links following or put you in touch if you need. So feel free to reach out to me as well.